Hi everyone, this is Dr. Keklak at Elite Sports and Spine Chiropractic, and welcome to this week's Elite Education Series. I'm here with Dr. Murhat today. What we're going to be talking about today is squat form, and it's something that we see in patients almost on a daily basis that come into our office, whether it's low back pain, knee pain, ankle pain, foot pain. We see that when we do a functional analysis on them, that their squat form is not up to par, and that's not your fault. That's the fault of anyone who's ever taught you how to lift weights, to do any kind of functional exercise where a squat is needed. Oftentimes we see our weight translated too far forwards, our hips not going back, our chest coming down. So the three things that we're going to talk about today with squat form are just that. We're going to focus on pushing our hips backwards, so what's called a hip hinge. We're going to talk about keeping our chest nice and tall towards the ceiling so that we're not bending forward at the waist, putting a lot of pressure on our lower back. And we're going to talk about our knee alignment in terms of our toes. Okay, so I want to, Dr. Murhat, the first thing I'm going to have him do is do squat form, a poor squat form. So where he's not doing a hip hinge, his chest is going to come down and his knees are going to come out over top of his toes. So we're going to have him do that here. And when you see that here, his weight starts to shift forward. And when that happens, we're putting a lot of stress not only on our lower back, but mostly on our knees, on our ankles, and our feet. So we're going to see a lot of knee problems, ankle problems, whenever we see somebody doing a repetitive squat motion when they have that kind of form. Okay, so a couple simple things we can do to correct this is the first cue that I always give anyone who's doing a squat is we want to push our butt backwards. Okay, so what I want Dr. Murhat to do, exactly, he's doing it perfectly. We want to almost like push our butt back and make it look bigger. So it's just a simple pelvic tilt backwards, just like he's doing. Okay, and that's going to force us to shift our weight backwards as opposed to going forwards. So we're going to keep our knees directly over top of our toes. Pushing our butt backwards is going to help with that. Okay, so the next thing is as he descends down into his squat is to keep his chest nice and tall. Now we all have this notion that when we do a squat, okay, we want to come and bend at the waist. That's the easiest way to get our hips back. So what we want to focus on is arching our back, okay? So hip hinging here, keeping our chest up and arching our back as we go down. And he does a really good job of that. He's actually using his hand as kind of like a marker. So you can put one hand on your chest, one hand on your lower back, okay? Right along the top of your butt. Focus on pushing into that hand, keeping your chest up as you descend into that squat. He's doing a really good job with that. And the last thing I want you to notice is the toes. And we're going to do a side view because I want to focus on the knees not going past the toe forward. And I want to focus on the knee staying directly in line with the toe from a forward view, not going out or in. So you see how he's doing that here. Whenever, and he could probably tell you this, whenever he focuses on pushing his hips backwards, it's almost impossible to get your knees out over your toes. You keep your chest up, your hips back, the knees are going to fall right into place. So I'm going to have him do a couple squat with good form there. So this is just something that whenever we instruct patients on how to squat, if we focus our first movement into that hip hinge, even before you think about squatting, whether you take it just step by step, you do a hip hinge and then come down, and then it starts to become a fluent motion. And it becomes second nature, just the hip hinge to keep the butt back, the chest up, the knees directly over the toes. Now, I'm going to center this a little bit more. When he does the squat here, he's going to focus on the hip hinge, the chest up, the knees directly over the toes. I want you to watch his knee alignment in terms of staying right over the toes, not going out or not going in. It looks pretty good. A lot of times we'll see the most common thing that we see in the office, or that I've seen in the office, he might be able to vouch for something different, is knees coming in. That's going to predispose you to specific injuries of the knee. That puts a lot of stress on the medial knee, whether it's the meniscus, the disc space in the knee, or whether it's the medial ligament structure of the knee. It puts a lot of stress on the knee when the knee comes in, and that can be due to a muscle imbalance, whether it's tightness of the adductors on the inside of the leg, weakness of the lateral hip muscles, whatever it is, it's putting a lot of extra stress on those structures of the knee, and it's predisposing you to injury. So I'm going to have him do one more time just so that we see. We're going to do good form, coming back up, and then that poor form with the valgus stress. So that's what we want to avoid right there. Okay, so when we talk about squat form, just to kind of sum everything up, we want to focus on three main things, and it's going to help you with your squat form. It's going to eliminate low back pain, knee pain, ankle pain, anything that comes along that you might be having with squat form here. It's you push your hips back. That's the first thing, a hip hinge. The second thing is keeping your chest nice and tall so we're not flexing at the waist. That's taking a lot of stress off our low back. And the third thing is keeping your knees directly over your toes. So we don't want to go too far forward. We don't want to let our knees go out or in. We want them directly over the toe. This is going to help avoid any possibility of knee injuries. Do you have anything to add, Dr. Murhat? Alrighty, so for Dr. Murhat, I'm Dr. Keklak here at Elite Sports and Spine Chiropractic. This is this week's Elite Education Series on squat form. If you guys have any questions, comments, anything, please don't hesitate to comment on the box below. And then if you guys have anything that you would like us to perform in the weeks to come, any topics you'd like us to cover, comment below. I know that next week I think we're doing hip stretches. I think that's the topic for next week. That was a recommendation from somebody, one of our followers. So if you guys have any recommendations on what you'd like to see, don't hesitate to let us know. Thanks for watching.